This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, well, good morning. This is a medical minute about something that might not be the most exciting topic in emergency medicine, but it comes up a fair amount, and that's elevated blood pressures in the emergency department. I think we all kind of know that it seems like almost everyone who comes in through triage has an elevated blood pressure, and there was an interesting study recently that tried to look and see of those patients, how many end up actually having hypertension and how many have something bad happen to them because of their hypertension. So in general, this was a large study in Canada that basically they have good follow-up because of a national healthcare system. So when they looked at this huge cohort of like 30,000 patients that came through their emergency department, they found that half of them had elevated blood pressures. So obviously it's not something that's unusual. And, kind of I think appropriately, only a small number, like 8%, got anything for their blood pressure in the emergency department. So most times we don't need to treat it. Most times it's not something that's an emergency. In terms of, follow-up and how many ended up having hypertension, it was actually a very small number. Less than like 15% over the next, couple months, years, were diagnosed with hypertension at all. And even the ones that had, really high blood pressures, like over 160 over 100, only a quarter over a 2-year period were actually diagnosed with hypertension and started on medications. And then in terms of who actually had a bad outcome, it was very, very small. And only people who had like really high blood pressures, like over 180, over 100, had a slightly increased risk of having stroke, heart attack, something bad happen. And those weren't immediate. They were, sometime in the like months to almost like year out from after being seen in the emergency department, they had a slightly higher risk of anything bad happening to them. So it's not like everyone we see with a blood pressure of 160 over 100 who gets discharged without blood pressure medications has something bad happen to them the next day. So overall, it's good to tell people, yeah, your blood pressure was elevated here, you should get it rechecked, but not anything to, be too concerned about either here or make patients too stressed out about it, just as long as they get good follow-up. All right, thanks guys.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.